Winter weather can be harsh to get through, and it's especially hard on the skin, which dries out from the cold, dry air. Dr. Bruce Katz is a dermatologist with a practice here in Manhattan, and he joins us now with some tips on keeping our skin healthy at this time of year. Thank you, Dr. Katz, for being with us.
My pleasure.
Tell me, we all know, as we just mentioned, that the cold, dry air is what ruins our skin this time of year. But when do you know, or how do you know when to go to a dermatologist, when it's that serious enough of a problem?
Well, dry skin just looks a little bit flaky and perhaps a little bit tight. When it starts to get swollen and crusty and cracked, and you'll see little cracks developing in the skin, red or even painful, that is time for you to be seen by your dermatologist.
That's a warning sign.
Right, that means it's getting very severe.
And take us through some of the different types of disorders that we can have at this time of year. The first one is eczema, is that how it's pronounced?
Eczema, that's right. Eczema really is the severe form of dry skin. And if someone's skin dries out to the point that we just mentioned, where it gets red and swollen and cracked, then you have eczema, and there are medical treatments to improve that. There are other conditions such as seborrheic dermatitis, which really affects more of the scalp and the face, chest and back.
What are those symptoms?
That's often, it looks like there's flaking and redness around the cheeks here, around the eyebrows, and perhaps dandruff on the scalp. And that's also a treatable condition too. There's also another condition called ichthyosis, which is very severe dry skin. And it's interesting, there was just a study in Rockland, Maine by Vaseline Research where they looked at the ability for moisturizers, and I think they used Vaseline Intensive Care dry skin formula for 2 weeks on people who had severe dry skin. And they were able to correct the problem. So we know in severe cases, these conditions can be cleared.
It's really something that's brought on or perhaps made worse by the weather? I mean, this is not necessarily a hereditary condition?
Well, some conditions, such as ichthyosis, may be hereditary, but generally speaking, eczema just develops from skin that's been neglected and hasn't been treated properly.
And the last one is
rosacea.
Rosacea.
Now, rosacea is a very interesting condition. That's sort of the condition that we think of as W.C. Fields with a big nose and the veins on the face as having. And people thought he was just drinking, and that's what caused this problem. And a lot of people who have this problem are thought to be drinkers or alcoholics. In fact, they have rosacea. And rosacea is really eminently treatable today, particularly with new laser technology. At our Laser and Skin Aesthetic Center here in New York, we're using new lasers to treat the broken blood vessels, aside from the redness and the veiny look that people have in rosacea and other conditions, and it can really clear it up.
Let's talk about what people can do this time of year to try to prevent this from getting to that severe of a problem. First of all, limit hot water use. Do not take hot water showers at this time of year. Also avoid harsh cleansers, I guess soaps and things of that sort, which can irritate the skin. Also pat dry your skin instead of using rubbing a towel on your skin. Wear cotton or silk, which again does not irritate the skin as wool does. And finally, use humidifiers. That it will certainly help at this time of year. Some good advice and some good information there, Dr. Katz. Thank you very much.
My pleasure.